Welcome to Pharmative Live Season 4 premiere. My name is Dr. James Partyka. I'm a clinical pharmacist, oncology research scientist, and the founder of Pharmative.com. Pharmative Live is all about connecting patients to healthcare professionals and scientists in order to educate ourselves so that we can make informed decisions with our doctors, nurses, and pharmacists about our medical care. That's Pharmative Live, and we're coming to you live from Palm Springs, California. Today's topic is that we're going to be discussing reducing your risk of a medication error occurring in your health care and taking care of yourself if you are sick or if you're taking medicine to prevent disease. So that's our topic today, and this is a 15-minute live healthcare forum, so you can either text your messages to me or you can always email me at info@pharmative.com. I want to first start off by with season 4 by thanking a number of people. Jimmy, for one, my partner with Pharmative and PNN Media, Pride Nation Radio at pnn.fm. I also want to thank a number of consultants that we work with and vendor supports to make Pride Nation Radio, PNN1, and Pharmative.com all work smoothly. Sometimes on certain days better than other days. But there's a lot of work that goes into all of the programming that PNNmedia.com produces in the Coachella Valley, in the Los Angeles area, and throughout the country and the world. So that's PNN Media Group, and this is Pharmative Live. And today's topic is we're going to be talking about reducing the risk of medication errors in your life and for your loved ones. We are brought to you by our sponsor, PNN.1 mobile app, but our mobile app has a plus also, and the plus means health. The PNN.1 Plus Health mobile app is available today at your Apple and Android stores. Not only does it have great music with Pride Nation Radio, as well as some retro quiz shows, retro sitcoms, cartoons, movies, but it also has a number of vital healthcare resource tools to bring accurate information to you and your family in the fingertips of your PNN1 Plus mobile app, which when you download yours today, looks something like this. This is the Plus version, Plus meaning health. And download your mobile app today for free. It's an exclusive mobile app which combines our original program here from PNN Media, as well as a number of healthcare resource tools such as a virtual pharmacy, a doctor symptom checker, find a clinical trial nearest you, and a number of other vital tools from reputable news sources such as the FDA, the CDC, the NIH. So check that out today. So let's start. This is a 10 to 15 minute forum, and my promise this year at season 4, we're gonna keep it to 10 or 15 minutes. Okay, so clock me, all right? Medication errors in 2021 in the United States is still an epidemic. And we don't even have an exact estimate of the incidence of medication errors. It's been estimated it ranges anywhere from 35,000 deaths to as high as 250,000 deaths due to medication errors. And by medication errors, not only am I referring to deaths, I'm also referring to something of a medication causing a life-threatening error, hospitalization, disability, and even a birth defect. Again, it's unfortunate that we have such a complicated healthcare system in the United States that we don't have a central repository for our healthcare information. It's very fragmented, and it's very difficult to accurately determine what that risk is of a medication error to you and your loved ones. But it's thousands, tens of thousands of people die each year due to medication errors. And as I stated earlier, it's because we have such a complicated system, but also we have developed so many medications over the last 40, 50 years that the medications themselves are very complicated in how best to prescribe them and how best for the patients to take them. So weighing that, what we call the benefit versus risk, is extremely important. So anytime you're taking a new medication, definitely clearly read the directions and make sure you understand them. Make sure it's the same dosage that your pharmacist or your prescriber stated that it would be to you, okay? And certainly you can review your new medications with your pharmacist, again, making sure that you're clear about the directions for usage. Now, again, we take medications for a clear benefit, all right? Following the labeled prescriptions that are available online or available at your pharmacy, and as well on the prescription bottle itself. So again, take medications as it's prescribed, and for unused medications, you want to dispose of them. And if you're unsure of how best to dispose of your unused, expired medications, talk to your pharmacy or pharmacy technician nearest you and they can give you advice. It depends on what type of medication we're talking about for disposing unused, expired medication. Again, whether we're talking about prescription medications or over-the-counter medications, very important to understand the directions. Take your medications in the broad daylight. If it's in the evening, turn the lights on. Make sure you're grabbing the right bottle. I, for one, as a clinical pharmacist, have made mistakes where I grabbed my multivitamin bottle instead of my cholesterol-lowering medicine, and I took my vitamin instead of my cholesterol-lowering medicine. Well, I'm still alive and well today, but it was still a medication mistake. Even though I'm a clinical pharmacist, I didn't have the lights on in the bathroom. Stupid me. So anything you can think of or do to simplify taking medications, whether you're a young person, middle-aged, or an older person, whether you have an acute condition or a chronic condition, okay, taking medications can be complicated, okay? Not only is our computer systems complicated for payer information and healthcare information in the United States, but we have a complicated, expensive, inefficient healthcare delivery system with multiple hospitals, multiple doctors, multiple specialists, multiple clinics, multiple pharmacies, mail order pharmacies, mail order clinics. It's complicated, and not any one prescriber necessarily knows all the medication that you are currently taking, which makes making an informed recommendation to you more difficult. And that's why I'm going to teach you some tools that you're going to be the expert about the medications that you routinely take in your life. So stay tuned. Checking the time. Okay, we're good for time so far. All right, that's great. I'm going to give you 6 ways to reduce the risk of medication errors for you and your loved ones, okay? The first thing is that you want to make sure you're the right patient, okay? Or that the prescription goes to the right patient, okay? And there are a system of checks by the prescribers and by the pharmacists to make sure. One easy way we do this is by asking you your date of birth, okay? It's just an easy one little check to make sure, okay, this name coincides with this date of birth, which is in my computer. We also use driver's license, valid IDs, and a number of other system checks. We use triple check verifications in the pharmacies to make sure that the medication dispensed to you is the medicine that your prescriber intended for you to receive. Okay, now remember, If you have any questions about any medication, the medication experts in the United States are your pharmacists. So get to know your pharmacists, okay? And get to know them on a regular basis. They can answer any of your questions for free. Where else does that occur in the United States? Pharmacists are trained to really understand all the nuances, the pharmacokinetics, the pharmacodynamics, the drug interactions, how the medications work, what's the best medication for you, and can work with your prescriber to make sure that you're on the best medication to treat your disease. Okay. The next thing I just want to state to you that in the pharmacy itself, they use NDC codes. Now, some of you and most of you are probably familiar with those codes, and those codes help us track the right medication to the right vial to the right patient. So again, a series of checks are in place. Most medication errors occur at the time of prescribing and administration of the medication. Okay, so the pharmacists have a very stellar record of negligible errors with regards to medication errors, dispensing the inappropriate medication to a patient, or providing inappropriate or wrong information about the medication to the patient. They truly are the experts. And so if you have a question on how best to use an inhaler, how best what over-the-counter medication you need. Do you have any drug interactions? Ask your pharmacist. They're right there. They're practically a pharmacy in every local neighborhood in the United States, and they can help you with all of those questions, whether it's for your children, your teenagers, yourself, or your parents, or family members or friends. The pharmacist is truly the medication experts. They go to school for 6 to 10 years studying human disease and medications and pharmacology and pharmacokinetics and pharmacodynamics and drug interactions, and it goes on and on and on. And they specialize in everything from oncology, like myself, to pediatrics, to cardiology, to nuclear pharmacy. They specialize in regulatory regulations and work for the FDA, and they do a number of things regarding. I also, at this time, want to recommend a website to you called drugs.com. You can also access this through our virtual pharmacy. So if you download your PNN1 Plus mobile app, it'll look like this. And you just scroll down to virtual pharmacy, like that. Okay, and it brings you up. You enter the medication of interest. It'll give you the dosage, it'll give you adverse events, but it also has a pill identifier. You ever find a pill and you see a code on it, letters and numbers, the shape of it? You enter that code and you enter the shape and color of the pill, and it'll tell you what that pill is through the pill identifier located on this app. You can either go to drugs.com or go to your PNN1 Plus Health mobile app. It also has a drug interaction checker, which I encourage everyone to do. Enter up to, I think it is 9 drugs, include your over-the-counter medications, and look for moderate to severe drug interactions. Read it, but then go over that with your pharmacy, because sometimes it requires a clinical intervention and sometimes it just requires monitoring. So it's really important, because your prescriber is not necessarily going to know what you take over the counter. One doctor doesn't necessarily know what the other doctor is prescribing, right? I highly recommend you only going to one pharmacy. So at least in that one pharmacy, all of your prescriptions are located there for you and your pharmacist to review together. And I also encourage you to make a consultant appointment with your pharmacist. Sit down and review all of your medications on an annual basis. And every time you go see your family practice physician or clinician, internal medicine doctor, start off, especially on an annual visit, reviewing the medications you're taking from this prescriber as well as other prescribers to make sure that you're all on the same page and that your medication list is accurate. Common sense, okay? We always want to make sure we have the right dose. And the tricky part about the right dose is looking at the unit of measurement. So milligrams, grams, micrograms. Sometimes it's hard to read those, so you might have to take out a magnifying glass on your prescription label. Milliliters, sometimes liters, tablespoons, teaspoons. Again, make sure you have an accurate way to measure what the prescribed dose is for you. Make sure you understand the route of administration. Are we taking it by mouth? Are we taking it some other way? Okay, very important. Subcutaneous, for example, intramuscular, for example, rectally, for example. IV medication can be administered at home with an infusion nurse, and so forth. So you want to make sure you administer it correctly. There have been medical mistakes where a medication is inappropriately administered, which has led to a fatal death. Okay? You want to make sure you're taking the medication as prescribed at the right time of day. So some medications are more effective if you take them in the morning, or if you take them in the evening, they may alleviate some of the side effects like drowsiness because you're getting ready for bed, so you take them in the evening, okay? Or sometimes you have to take medications around the clock every 6 hours, depending upon what condition we're talking about, what kind of medication we're talking about, and so forth. So make sure you understand, again, get into a routine of taking your medications and understand whether you should take it with food or without food. Now, a very common drug interaction that I'm going to state as an example to you is a drug that's available over the counter. It falls in a category, what they call a proton pump inhibitor. It's a strong, potent inhibitor of acid into your stomach and small intestines. Okay, and this medication actually can interfere with the absorption of other medications. So when you're taking Prilosec or drugs like Prilosec over the counter, you're only supposed to take them for about 10 to 14 days for severe heartburn. Okay, if you're taking it longer, you need to talk to a GI specialist or your family physician about what's going on with regards to your severe heartburn, your GI tract lining. Maybe something else is happening. But you should not be taking these medications over the counter chronically because they do interfere with the absorption of many drugs, because drugs typically require some acid for absorption. So does that make sense? So if you're taking a proton pump inhibitor or even an H2 blocker like Pepcid, it might be better to space it out. Take your prescription medicines in the morning and maybe take your antacids in the evening so that you don't impair the absorption of the medication that you were prescribed. If the medication is not absorbed into your bloodstream, it's not going to be effective. Okay, so documentation. It's so important that the prescribers, the clinicians, the technologists, the pharmacists all work together so we appropriately document the medication that you are currently taking and can retrieve that information so that we can make clinical decisions about your illness or about the medications that you're currently on. Again, it's important to routinely review all medications that you're currently taking with your physician so that they are aware. Again, they may not be aware of other prescribers, okay? They're aware of all of the medications that you're currently on. Now, if you unfortunately were hospitalized or taken to an emergency room, have a family member, a caregiver, gather up all your prescription medicines, put them in a plastic bag, and take them with you. That's important so that they know the exact drug medication name, dosage, the route of administration, so the continuity of your medication continues. Very important for certain types of illnesses, like, for example, diabetes, that your glucose levels maintain normal levels as you suffer some other kind of event, or you're suffering from a diabetic complication. Okay, take your prescription medicines with you to the hospital in the bottles. I also recommend, as a pharmacist, to keep your prescription medications as well as your over-the-counter medications in the original container. That has the accurate information on it. And the minute you transfer it to another container, that means that you could make a mistake. Okay, you know how you have those calendar plastic dispensers for 7 days or for 30 days. And for some people that have a caregiver watching over them, that may be necessary in order so that it's a reminder of whether they took their medicine that day or not. And these are the medicines they're taking on Saturdays, Sunday, Monday, and so forth. Okay, but if possible, keep them in the original containers to avoid mistakes. Over the last decade or so, a lot of regulations have been put into place. Prescriptions are written in clear, plain English. We avoid Latin abbreviations in the old days that I was trained on to avoid mistakes. So by far, the vast majority of prescriptions are electronically transferred from the prescriber directly to the pharmacy in plain English. It's still easy, unfortunately, to make mistakes. I'll give you an example. Zantac, which is an H2 blocker, was taken off the market. It's an antacid for heartburn because of a cancer causing agent in the formulation of Zantac. The generic name is ranitidine, taken off the market. Brand name was Zantac. You may be familiar with it. It's a drug similar to Pepsid. Okay. Over the last year or 2 years, they released a new formulation, the company did, calling it Zantac 360. Okay. But it doesn't contain the original ranitidine that was in Zantac. It contains the active ingredient in Pepsid called famotidine. So Zantac 360, which Zantac used to be ranitidine, is now famotidine. Hence the confusion, okay? So it's very easy with the names, and the names change based on what country you're in. And there's at least 3 names associated with any medicine, okay? The brand name, the generic name, and the chemical name. Very easy to mix up the names. So again, that's why all prescriptions now are written in plain English. They're electronically transferred, the vast majority of them, to the pharmacies. Pharmacy reviews them for appropriateness, for accuracy, for completeness, as well as for the dose and the schedule, making sure that it's appropriate for the patient. And if he has questions, and oftentimes he does, he calls the prescriber to clarify that for you. You may or may not be aware of all of the interactions that occur between the prescribers and the pharmacists, but there's always a great deal of questions regarding any prescription, whether it's the appropriateness, whether it's the dosage, whether it's reimbursement issues, whether there's just something missing from the prescription itself. I'm sure those of you out there who have been on prescription medicines do probably have a similar experience. I've had a similar experience. I have had problems with my medicines. I am a victim of a medication error. So listen, that's one of the reasons why we're talking about today. Okay, so let's see. We have another few minutes and then we'll be done with our first episode of season 4. I want to acknowledge Helen and Thurman out there for being here on live, as well as Jimmy and a number of friends out there as well. We're talking about medication errors and we're finishing it up now, and this broadcast will be available for playback right after we're done today on Facebook, and then eventually it'll be available on Pharmative.com, Pharmative YouTube, as well as PNN Media YouTube for replay. Okay, I am a big proponent of keeping a healthcare journal. And you can do that either on a notepad, or you can do it on your phone or electronic tablet. Okay, and in this healthcare journal, you are going to just list your contact information. Okay, you're going to list your height, your weight, your age. You're going to list your known drug allergies, your known food allergies, your current medical history. Keep it brief, to the point. It should only take 5 to 10 minutes to create this. If you haven't done so already, it's a living document, so you can change it along the way. You can list out your vaccination history. You can actually take a photo directly into your notepad on your phone or tablet and embed it directly into your healthcare journal. Take a photo of your vaccination cards. That way you always have it. Or you can certainly take an image and paste it into your tangible notepad, okay? And when you list out your medications, not only do you want to list out how you take your medicine, your dose, your schedule, whether you take it orally or not, how often you take it, but the reason. So I take Lipitor, generic Lipitor, 10 milligrams daily for high cholesterol, okay? And that would be your medication history. Then follow that with your vaccination history, which is really helpful now, keeping track of, and those of you who are not vaccinated, get vaccinated. And those of you who are candidates for COVID-19 boosters, get your booster shots. Vaccines are safe, effective, been proven in clinical trials, as well as the real-world evidence to prevent severe COVID-19 disease, reduce hospitalization rates, and reduce deaths. So get vaccinated for COVID-19 and keep your vaccination cards in your healthcare journal. So I'm just going to show you that right now. Let's see. This is my healthcare journal. You know, I am a pharmacist, so it's a little bit more detailed. But you can see right here, my vaccination cards are directly into my notepad. On top, we have my contact information, okay? Now, you can take a picture of your insurance cards, which I have right here, I even take a picture of my driver's license, my dental card, my vision card. I also even have a credit card in case I'll lose my wallet, driver's license, stuff like that. But another trick of the trade, take a photo of your prescription bottles. Okay, now this label, I actually took 2 photos, front and back of the label, because it was kind of like, you know, split backwards and forwards. So it not only gives me an accurate name of the medicine, the dosage, and the schedule and route, but it also gives me my pharmacy number and my prescription number all on my phone. So if I need to call in for a refill, or if I need to have a question about a medicine, it's all there available in the office. I can't tell you how many times I go into my doctor's office for my annual checkup, and I review all the medicines with them, and I show them my healthcare journal. And that's one way that you can easily reduce medication errors for yourself and for your loved ones. Keep a list of your medications, whether it be on a notepad or actually on your phone or your e-tablet. Let your caregivers or your family members know where you keep that list. I wouldn't be so concerned with privacy issues, although a lot of the phones have a lot of security measures so that people can't hack into your phones. But it's more important to me that I have an accurate list of my medications, and I'm willing to put that on my phone so that it's always with me, including my vaccination card. All right. The last point I'd like to make is oftentimes pharmacies will change the manufacturer of a generic drug to save money, and ultimately pass that savings on to you, hopefully. So oftentimes generic medications, the color and the shape of the pill may change. And if it's not flagged to you at the time of receiving the medication and you notice a change, you definitely want to contact your pharmacy and make sure that it did not make a mistake in dispensing the medication. You can also go on drugs.com or through your PNN One Plus Health mobile app, go to the virtual pharmacy pill identifier, enter the code and the shape of the pill or capsule, and it'll tell you what that medicine is and whether it's the correct medicine for you or not. I'm also not a big proponent of mail-in pharmacies. I think that in order to, again, minimize the risks, medicines are becoming more and more complicated. We see that with COVID-19. Pharmacies are becoming more and more important as a gateway to healthcare. We see that with COVID-19 vaccines, and all kinds of vaccinations can be obtained through your pharmacist, through your nearest pharmacy, which is really important to prevent disease. So again, I'm a proponent of getting to know your pharmacist in your neighborhood, going to the same pharmacy. Don't switch pharmacies unless there's a specific reason to do so. Keep track of your medicines by keeping track on your notepad on your phone, or on your tablet, or on an actual physical notepad, and take that with you as well. Also, you might want to include your medication alerts, if you're a diabetic or not, if you have a cardiac history or not, if you're a transplant patient or not, if you're immunocompromised or not. And again, if you haven't gotten vaccinated for COVID-19, get vaccinated. There are many people out there that are immunocompromised. Our children have not been vaccinated as of yet. It's a highly contagious, highly deadly disease. The vaccines available, the Moderna, Pfizer, and J&J vaccines are safe, effective. They prevent severe disease, they prevent hospitalizations, they prevent deaths. So get vaccinated, and if you're a candidate for a booster vaccine, get your booster vaccine as well. And you can do that by going to text your zip code to GetVax, GETVAX. Text your zip code to GetVax, and that'll give you a list of pharmacies and clinics where you can get vaccinated today. That's the first episode of season 4. This is Dr. James Partyka. Until I see you next time, stay healthy, as it's easier to prevent disease than to treat it. I'll see you next week.